Live from the KGO TV Broadcast Center, this is ABC 7 News.
All right, well, when ABC 7 News at 6 continues, fixing your aching back.
Yeah, the advance is making the pain go away and still giving you a full range of motion. Back in a moment. Technology still considered experimental in the United States is now being used to treat severe back pain or pain in the lower back.
And unlike some alternatives, it can preserve a full range of motion. ABC 7 Morning News anchor Eric Thomas reports.
Tim Goodson is a man who likes to move fast.
Motorcycles and hot rods racing.
But earlier this year, severe back pain left him worried about moving at all.
At first, it was sort of slow, and then within about 3 weeks, I could maybe do 5 steps and have to sit down on something hard.
A piece of the disc came out of the space.
San Francisco spine surgeon Dr. Kenneth diagnosed a deteriorating disc in Tim's lower back. For decades, the most common solution has been to fuse the surrounding vertebrae together. While it does ease pain, Dr. Light says the fusions also limit natural movement and can move the problem up or down the spine.
It creates a stress riser, or a point of stress, where the fused part of the body attaches to the mobile part of the body.
Instead, Dr. Light recommended an emerging technology called a disc replacement. Rather than fusing the surrounding discs, a surgeon essentially caps the two surfaces with a metal plate. A high-strength polyethylene disc then slides between the two, acting as a replacement disc and allowing the spine to twist and flex. While disc replacements have been approved in Europe for years, it's still considered experimental here in the U.S., and it could take months of negotiations with an insurer to convince them to cover the procedure. Tim's case was also complicated because it involved the lower back, which absorbs more stress than upper parts of the spine and neck. Still, Dr. Light says advances in materials have made the disc replacements strong enough to handle the force.
It's made out of the same material as a total hip, and those materials resist compression very well.
To reach the area, Dr. Light actually performed the surgery from the front, delicately moving past the organs to remove the existing disc and extra bone to ultimately slip the caps and replacement disc into place.
And let's see you bend over, touch your toes.
And while recovery can take several months, Tim says he's regained enough strength to do the things he enjoys most.
I can lift weights, ride a motorcycle. I walk. Matter of fact, every morning I get up and walk 5 miles every morning.
Free of pain, the man who once worried about walking is now planning a ride with his wife along the California coast. Eric Thomas, ABC 7 News.
Great.
Yeah.